Hello and welcome everyone to today's webinar. Today I'm very excited to talk to you about a powerful piece to the cardiovascular disease puzzle. Everybody's wondering what it is, and I'm excited to reveal to you what I see as a very necessary step to preventing and reversing heart disease. So for those of you who don't know, my name is Diamond Fernandez. I'm the founder and director of the HeartFit Clinic. Of course, if you want to read more about me, you can check on some resources online. Hopefully there's a lot of good things out there about me. But nevertheless, let's get started, and I'm excited to talk to you about this cardiovascular disease puzzle. So I'm going to go through all of this a little bit in less detail, but a lot of things, some of you have come into our clinic, or some of you are looking at coming to our clinic. For those of you who know that we do artery health and function testing. We look at inflammation. We look at cholesterol with more detail, of course, for those of you who know out there. I'll get into that in a second as well. We look at diabetes markers. Overweight is a big risk factor. Genetics is a big risk factor as well. And for those of you who know, we do genetic testing, but I never recommend it because you can really turn your genes off and on as depending how you live your lifestyle. Hormone function is a very big one that we focus on. And then micronutrient deficiencies. So today I'm excited to talk to you about the micronutrient deficiencies, and that's really the missing key. And I'm going to talk about how missing it is, and something that's very missed in a lot of looking and trying to prevent and reverse heart disease. So the goal today, just to quickly run down, again, I want to thank you personally for taking the time out of your busy day to come and hear me speak about this aspect of it. For those of you who don't know, I'm very passionate about preventing and reversing heart disease. So today I'm going to talk about the cardiovascular disease puzzle in more detail, why it's important to test micronutrients. I'm also going to cover some micronutrient deficiencies and some health disease wheels. I'm going to also talk about micronutrient deficiency in medications and how it affects your arterial health. So let's get started. Cardiovascular disease, here's the puzzle that I have here. I just kind of broke it down a little bit more in detail. So I talked about genetic markers, and you can turn your genes off and on depending on what's happening there. But the conventional way of looking at it is you can do a family history and see where your risk is. But if you don't know your family history, or if you want to know if you have the genetic marker, there are other protein markers and apolipoprotein E markers to see if you are or have the genetic markers. And I don't think your genes actually make your fate. It's how you live your lifestyle makes your fate. And again, your genes can turn off and on as depending how you live your lifestyle. But that's the integrative approach and the conventional approach. And I'm going to talk about what you can get done, let's say visiting your family doctor, and kind of what we focus on in a little bit more detail on the left. Looking at artery disease itself and looking at inflammation, they're very interrelated, especially if you have what we call coronary artery disease or actually stroke. Integrative look at it, and what we do is we do artery screening, so we determine the age of the arterial wall and artery function. And conventionally is a stress test, but if you're getting a stress test done for diagnostic reasons, the outcome from that, and I have a whole presentation talking about that, is neither good. So you're either going to end up with a clean bill of health, or you're going to end up getting further diagnostic testing, which involves a lot of radiation and radioactive dyes and whatnot. And so neither of those are any good. And I have a talk about that aspect of it, so I won't get into it in detail here. But echocardiograms and angiograms are really the gold standard of looking inside your arteries, but even then it doesn't necessarily matter, and I'll get into that in a second. And when we talk about stress tests and echocardiograms, it's not that I'm against these. I think it's important. It's just the next step as to what you do from that aspect of it. And then we look at really some key inflammatory markers with heart disease, where it's not really a big focus. We don't really focus in the healthcare system about really inflammation. It's kind of a secondary step. But when you look at this is an artery, and over time, I've sectioned this off here, but you can see what happens at each stage of artery disease. And before it comes to this and starts to be what we call a vulnerable or complicated lesion, which is a lesion that's stopping blood flow, it takes a while for this to develop. And the problem is sometimes this takes a long time or a good thing is that it takes a long time to develop here, or sometimes this can happen, very quickly. I mean, I'm seeing heart disease more and more with people in their 40s. So, we had one person in our clinic in their 20s with coronary artery disease. So it doesn't really have an age anymore as to what's happening. But this timeline can happen in any way. And really what we want to focus on is this aspect here, because this is the analogy where I talk about like a pimple on your face, and it can bleed and explode its contents inside the arterial wall. And this is where you can see your family doctor, get a clean bill of health here. You can even see a cardiologist and get a clean bill of health. And they'll look at your arteries and they'll say, well, your arteries are okay, or there's some minimal disease, but this is the most dangerous. And this is really where we got to focus on preventing heart disease. I think we fail here. When we get to this level, this is where stress tests will start to show up. But it's before that, and this is a heart attack actually happening, it's before that we want to look at. And the composition of this artery is very unique, and I'm going to see if I have a slide on this here coming, but the majority of heart attacks actually occur with blockages that are less than 50%. So it's pretty scary, and I'm going to go back to the bigger slide here. This is where the majority of heart attacks occur. It's because this breaks off, this little plaque lesion breaks off and spills all its contents inside the artery. So you can go from this stage here to a rupture to a myocardial infarction within days, hours, weeks, versus what would be years to get up to this level. Hello and welcome, Heart Health members. Today I'm excited to be talking with Dr. Caldwell Esselstyn. So he's a medical doctor. There are some metabolic going down the cardiometabolic risk here. There's some key diabetic markers that we look for. We look at particle size tests and artery tests with a metabolic disease. And conventionally, what your doctor will look at is your weight and your blood sugar and your blood pressure and your cholesterol. While those are all important, I think it gets dismissed a lot, especially with weight and blood sugar. And sometimes we just try and mask it with a pill, but that's not the solution. And so, for those of you who know and don't know, your cholesterol comes in two different shapes and sizes. And the best way I say it is, imagine that your artery is protected by a tennis net. You have golf ball sized particles and you have tennis ball sized particles. And tennis ball sized particles, you can see here, are large and fluffy and they don't cause any problems. But the small dense golf balls will, and that's why Maria over here is at greater risk, even though Maria has the exact same cholesterol number as Jerry here. Over 50% of people with normal cholesterol can end up with heart disease. That's the reason why, is because of the size of the cholesterol. And then we look at hormone function. With conventional approach, it really doesn't focus on it too much, but we can do comprehensive hormone panels, female and male panels, sex hormones, regulatory hormones, thyroid and adrenal function. Those are important, and they're very important, especially when we're looking for other types of heart disease that are out there, such as atrial fibrillation or arrhythmia issues or muscle concerns or inflammations outside the heart itself. And then we talk about nutrient deficiencies. And nutritional deficiencies are not a primary focus in conventional medicine. And even if they do look at it, they'll be able to have a look at a few different things. And they look at it what we call a serum level. A serum level kind of gives you a look at what's happening in the last day or two of what your minerals and vitamins might be. But integrative approach is looking at a functional micronutrient testing, and it's intracellular. So what happens is when we send the specimen to the lab, they actually grow it for a handful of days and actually try and get right into the cells of the blood and actually see what's inside of there and what is it on an intracellular level. So that's what it means by that. So why should you test? Well, that's the big important thing. Why should I test my micronutrients? Well, the big thing is either you can maintain yourself. So either you're doing the right thing, you're supplementing very well, you're eating very well, and you're doing the right thing. So at least you're on the right path. And then the big thing, of course, and my favorite, is to move the time clock back. And that's focusing on prevention. So if I told you that there's an accident going home today, you wouldn't take that road, you can take another way. And so it's really prevention and moving the time clock back so you don't end up with a problem. And then you can, if you do test, you can decide on what supplements or nutrition or drugs that might need to be taken so that you can then replenish. And so the idea is to recognize, test, and then replete, and then all of a sudden you become the hero. So when we look at the atherosclerotic timeline, when we look at specifically micronutrients, there's a whole bunch of biochemical pathways that exist along the whole way here, even to a point of what we call an exploding plaque that happens on a micronutrient or a biochemistry level. And I'll get into that a little bit later today. And so the idea, and this is the big deal, and this is really what we focus on best, is when you look at an artery, the idea is that we do not want it to have it protection. This is the skin of the arterial wall. You can see how thin it is here versus on the right side, it's a great thick wall and nothing's going to burst through there. So the plaque is not going to open up here, where here it's very vulnerable. And the idea is that we want to move from here to here. And so how we do that we don't really focus on that. In all honesty, I don't know. I can name a few of the cardiologists that do, but not many cardiologists or even surgeons focus on this aspect of it. They just care if it's blocked or it's not, or if you have this opening, they still won't even touch it. But this is the most dangerous on the left-hand side. So the idea is when we're doing testing is to understand the difference between intracellular and serum. We focus on intracellular, whereas your family doctor on some small elements there can look at the serum level and see what's going on. And the best way I can say it is we focus on a long term. We can see what's been happening over the last 6 months of any deficiencies you might be having, or you're either maintaining things very well. Where, if you go see your doctor and you get a physical done, they can see what your levels are. So let's just take vitamin D, because I know that can be done in our healthcare system. Mind you, they're weaning it out here with that, and that's just another expense thing. I think they've stopped doing it, in fact, altogether. But nevertheless, if you can check a specific vitamin, it's only looking at a small idea for that. So the best way I can say it, for those of you who are diabetic might understand this, so it's kind of like checking your hemoglobin A1C. And when you look at a hemoglobin A1C, it's kind of like, the best way I can say it, for those of you who don't know what hemoglobin A1C, it's a 3-month average of your blood sugar. And so your blood sugar is just a one-time measure of what you've been eating over the last, day, where a hemoglobin A1C is looking at 3 months. So that's the best way I can say it, intracellular versus serum. So when we look at micronutrient testing, there are 33 important micronutrients that we test when we do the micronutrient test, of course. And 33 is a really cool number. It actually used to be my hockey number when I was playing, and long story about that. Those of you can meet me, I can talk to you about that afterwards. But anyway, I love the number 33. It actually is my favorite number. And that's not the reason why we check 33 elements. That's how it comes. So we look at specific vitamins, we look at minerals, amino acids, antioxidants, fatty acids. We look at your carbohydrate metabolism in more detail. We look at your Spectrox and Immunodex. What that is we look at your antioxidant function, and we also look at your immune response score. So we come up with two different really cool scores, and then we look at your metabolites and see what's happening at that level. So all of these testing is really great, and you get some really great numbers to see what's happening. And so when you look at the tests that come back on all 33 of them, we can see, okay, are you deficient? Are you kind of in the borderline range? Or are you really adequate? And adequate, it gives you a nice green zone here. And if you're borderline, it gives you a black number. And so the idea is that you can see what's happening. And so for patients out there that are taking magnesium, they can see, okay, well, magnesium is actually working. Or if you're taking calcium, we can actually see if it's working. Or maybe you're taking a calcium supplement and you're not absorbing it well, which is even quite a common thing, unfortunately, where patients will come see us and they'll say, okay, well, I'm taking this supplement, well, why is it not doing that well? And then you have to question the supplement. And I mean, I can talk to you all day long about supplements and what you should and shouldn't have. There's a couple websites out there that we check the validity of the supplement, but it's important to kind of look at this aspect and kind of see what's going on. So with micronutrient testing, what we can see is the idea is to really fix many downstream issues. And there are so many biochemistry pathways in our body, of course, so many, I don't even go through them all, that if you're deficient in any of these micronutrients, it can affect these biochemical pathways. And that's why it's important to test. And so when you look at micronutrient deficiencies in your health, it can affect so many different things. And I will give you these slides. I think many people want copies of these slides, so I'm going to start to do that. I have no problems with that. There are going to be PDFs on this. Just ask me or email me, and if you want these copies, and we'll have access to these. So you can go, I'm not going to go through each one of them and talk about them, but I'll give you copies of this. If you have inflammation in your body, and inflammation can come in many ways, you could be deficient in any one of these things to understand that, okay, well, the biochemical pathways of inflammation get affected with all these different things. So I'm not asking you to basically supplement with all these, but what I am asking you is to kind of test and see where you are, and then replenish, and then all of a sudden you kind of decrease inflammation. If you have dyslipidemia, which is increased cholesterol or abnormal cholesterol, it can relate to any of these deficiencies, what's going on. Hypertension, same idea. If you have high blood pressure, it can affect, if you're deficient in any of these, then again, it can result in high blood pressure. And we've had many people come to our clinic, get tested, replenish, and then all of a sudden they don't need their blood pressure medications anymore. And that's where, of course, it's a combination of all the things that we talk about, but then that's where we become the heroes and trying to help people. Diabetes, same idea. Are you deficient in any of these essential vitamins or antioxidants or minerals that can cause diabetes? Sleep apnea, again, a big health concern. Anxiety, depression. You can see it goes on and on with all these different aspects of it. Weight management, if you have concerns with weight management, are you deficient in these essential nutrients that is causing you or preventing you from losing weight? And then there are a whole bunch of other disease wheels with cancers, fatigue, headaches. There was a really cool study that just came out talking about migraines and how 50% of women who end up with migraines are actually at increased risk of cardiovascular disease. And fertility, if you have male or female infertility, it can cause problems. And then also gastrointestinal health. 90% of the diseases that happen are actually result of your gastrointestinal system. Believe it or not, it actually starts in your mouth. And so when we talk about nutrient depletion and in medications, there's this big handbook that I read a while ago. I don't expect you to read this. I don't know. It's a textbook. I don't know. It's probably about 50, 60, 70 bucks. I don't know what it is. But the point is that it talks about nutrient depletion in medications. And when you look at nutrient depletion in medications, there are side effects that come from medication. There's not many medications out there that don't come with side effects. But the idea is that with nutrition deficiencies, the metabolic pathways that it can affect can cause a myriad of other concerns. And so the idea is to basically replenish those nutrients and then minimize those side effects, or even then perhaps coming off those medications. And that's a functional way of looking at your health, your cardiovascular health, versus just masking it and curing things with a pill. So let's just talk about aspirin first. Aspirin is a very common cardiovascular drug, and I'm not asking you to come off of these medications. That's not my goal here, but I understand that you could be deficient in these medications and therefore replenish, or even possibly come off them depending on the situation. Everyone's individualized, and that's why we treat people individualized. We don't do this blood test and then have a generic consultation. It's individualized when we do these things. And so there's vitamin C, B vitamins that you can be deficient, calcium, potassium, iron, sodium, and all these things. When we look at these deficiencies, aspirin, in all honesty, and I question as to whether aspirin will actually pass drug trials in today's age, but nevertheless, it's actually a very good drug at preventing blood clots, and it's a very important one. But there are some other drugs now that are coming out there that are showing to be better, but this I don't think would be an over-the-counter medication anymore. But nevertheless, that's not the point of this topic. Going into non-steroidal anti-inflammatory drugs, these are pain drugs that you might be taking. It can cause you to be deficient in vitamin C, again, the B vitamins, vitamin K. I'll get into this in a quick second here. Calcium, magnesium, and even selenium and zinc. And so when we look at all these things, well, wow, this is a big deal. If you're taking these drugs on a regular basis, you could be deficient in these things if you're not eating well or replenishing well with your nutrition. And so statins, a very highly prescribed medication. I'm not a big fan of statins in a lot of people, and some people absolutely need them. So it's all individualized as to what's going on. So coenzyme Q10, it makes it deficient, and it's actually 8 of them here. Vitamin E, vitamin D can get deficient, vitamin K. And with vitamin K, it can actually cause arterial plaque. It actually can increase the process of coronary artery calcium scoring. So that's something that can happen with a statin medication. Magnesium is another big one that it takes away from. Carnitine and selenium, and I believe I have one more here, zinc. And so when we look at a statin or a cholesterol-lowering medication, you got to understand, okay, what am I trying to do? I'm trying to lower my cholesterol. What are things I can do to lower my cholesterol? Or if I'm taking a statin medication, understand that, okay, you could be deficient in these things, especially if you're not replenishing well in that. And of course, another thing that people don't understand is that statins can affect heart function. And so again, for those of you that may be or close to heart failure, again, a question as to, and this is a big deal with what we call ischemic cardiomyopathy or ischemic heart failure, I question the use of statin therapy in that situation as well. So there's a whole bunch of research out there showing that it can obviously affect heart function. So what can you do? And that's something where we individualize it. And I got a really good talk that's going to be coming out soon. and I promise I'll let you know of it soon. We're going to actually probably do this live, and it's the statin or not to statin, and that is the big question I got. For those of you who know a little bit of Shakespeare, it's coming soon. So again, talking with nutrition depletion and medications, diabetes, it can affect the B vitamins and B12, coenzyme Q10, carnitine, lipoic acid, magnesium. With beta blockers, it can affect coenzyme Q10 again, antioxidant health, and there's a whole bunch of antioxidants out there. There are ACE inhibitors or ARBs, which are medications to control blood pressure. It can affect zinc, coenzyme Q10 again. And with diuretics, and diuretics can affect quite a few depletions. B vitamins again, vitamin C, magnesium, calcium, zinc, and vitamin K. And also can cause muscle spasms and arrhythmia. So you got to be careful with the diuretics as well. So the idea is that with nutrition depletion in medications, it can impair the cells. It can affect what we call the mitochondria, which is the powerhouse of the cell. It can use up key antioxidants in your body, and it can alter gut health and impair absorption. And remember how I talked about 90% of diseases start in your GI tract, in your gastrointestinal tract. So, it's kind of a catch-22. We're taking these medications to prevent disease, yet it causes another concern down the road or down the pathway. So again, it can affect diabetes, it can affect glycemic control, cardiovascular disease, dyslipidemia, which is abnormal or high cholesterol. It can affect vascular inflammation and hypertension. So there's some big ones that really we talk about with that. So how does this all relate to our arteries of our health? And people wonder, okay, well, what's the big deal here? Well, when we look at artery disease, and again, taking you to this timeline, all of this process, when a cholesterol plaque starts to happen, it happens and gets inside the endothelial lining. I'll show you some cool slides with this, but I'll try not to get too technical. If you're deficient in if you're deficient in micronutrients, then you have to be able to look at, okay, well, if I'm deficient, it's going to speed up this process. And more importantly, the best type of heart disease is the one on the right here. The worst type of heart disease is the ones in the middle here. And many people may have vulnerable plaques that they don't even know about. But these are the most dangerous. And the idea, it comes down to really strengthening this endothelial lining. So this is all these metabolic pathways that happen at different stages here. You can see at the top, this is a nice healthy artery. And then when we have endothelial cell dysfunction, there's a cellular level as to what happens in this. And if we're not replenished well in our nutrients, specific micronutrients, then we end up with a process of atherosclerosis, and all this biochemical pathway starts to happen right to a lipid core. And so to give you an example, if you have high magnesium, and this is looking at an artery, with high magnesium, you're going to increase the bioavailability of nitric oxide. And nitric oxide is a very important element, because what it is it helps dilate the arteries. And you decrease a whole bunch of inflammation factors that can happen that can cause a cut, basically, to the arterial wall, is the best way I can say it. But when you have low magnesium, the permeability of the inner lining of the arterial wall, which is the endothelial lining, it can open up, and that's where it can cause an injury, basically. And that's where then plaque comes to the rescue, cholesterol comes to the rescue and patches that up. And so then you decrease the bioavailability of nitric oxide when that happens, when you have low magnesium, and you increase the inflammation response. Basically, these are the white blood cell response that happens in that artery. So a normal artery versus a dysfunctional artery. This is just giving an example with low magnesium. And so the idea, again, comes down to doing this. How do I turn an artery that looks like this to over here? And this is truly how we reverse heart disease, is by strengthening the inner lining of the arterial wall, called the endothelial lining. And so, yes, you can still have blood flow here. This is the lumen. The white area is where the blood would flow, and all this is blocked up. But it's nice and stable. It's never going to cause a problem. Where on the right, you have even a bigger lumen here, but this is very vulnerable. And when we look at this, I got a whole bunch of pictures like this. The idea is you want to really strengthen this endothelial lining versus having a small cap over it. And it comes down to my analogy talking about that pimple on your face. The idea is to reduce a pimple is to strengthen the skin on the face. If you have weak skin, the pimple is going to break through the skin and cause an inflammation response. Imagine that happening inside your arteries. So this is a nice stable plaque formation. So yes, we ended up with an inflammation response, but the plaque is very stable. It's protected by a nice fibrous cap and a nice endothelial lining. A nice strong skin is basically what I'm going to say. This little circle stuff is the skin of the arterial wall. When we end up with an explosion, if you end up with a weak skin, this is where we start to bleed outside, and a whole metabolic pathway starts to happen in this aspect of it. And so the real goal, and this is what we do best, is to turn arteries that look like this to over here. And how we do that is by focusing on really making the nutrients really at its highest optimal benefit to your body. And so when you have a diseased artery that looks like this, the idea is to clean this out. And this is without a stent or bypass surgery. You can do this, but it takes work. But what we do best, of course, with our clinic is you can see all the collaterals are not so much over here, but you can see now the increased collaterals that happen from heart disease there. So now all of a sudden this person had heart disease, but is way healthier than they ever were before. So the cost of supplements can be hundreds of dollars a month. Some of them can also be unnecessary, but some of them can be very vital. And so the investment is really important to test to see where you are and then where you may be deficient, and all of a sudden you feel better when you start to replenish things. And there is a cost for not doing this. The side effects of medication that you can't see, and are you eating well? And that's the big key. Are you eating enough or well enough to be able to continue down this path that you are? And if you want to live very well or with a very good quality of life, you have to make sure that you're supplementing what you might be deficient in. So to book your micronutrient test, make sure you call our clinic, or you can email us at admin@heartfit.ca, or my email. Most of you have my email or would have sent this webinar via that email. And you can reach us, of course, on our website at www.heartfit.ca. So heartfit.ca. And of course, we want you to live happier, healthier, and longer. Thank you very much for listening. So if you have any questions today, I'm not going to take them during this webinar, but please message me in the box there, or you can email me, or even call our clinic, and I'll be happy to answer any questions that you might have from this webinar, and I can help you with that. So again, live happier, healthier, and longer, and here's to your heart health success. Take care.